Welcome to the marathon season of NEETABLE MDS Pathshala podcast. I am your host, Dr. Thingra, and you are a NEETABLE. Tune in for a new episode every day till the NEET MDS 2022 exam. This episode is called Oral Surgery One-Liners. Now this is going to be a very interesting episode in which I'll be just stating a few facts which are very commonly asked in MCQs. So they'll be just statements and their values or something like fill in the blanks. So this is going to be a very exciting episode and a different one. So let's get started. The maximum dose of lignocaine without adrenaline is 4.4 mg per kg body weight, and it should not exceed 300 mg. The maximum dose of LA that can be administered with vasoconstrictor is 7 mg per kg of body weight, and it should not exceed 500 mg. The maximum acceptable dose of adrenaline in normal patients is 0.2 mg. The maximum acceptable dose of adrenaline in cardiac patients is 0.04 mg. The optimum speed of administration of LA agent is 0.1 milliliters per second. The strength of xylocaine used in dentistry is 2% with adrenaline, that is, which amounts to 1:80,000 concentration. The ECG changes can be first observed when the level of lignocaine is more than 5 to 6 micrograms per ml. The most commonly used local anesthesia is 1:80,000 xylocaine HCl, or also called as lidocaine HCl or lignocaine HCl. The concentration of epinephrine added to local anesthetics is 0.01 milligrams per ml. The dose of epinephrine given in anaphylaxis is 0.5 milligrams in 1:1000 dose intramuscularly. The onset of action of lidocaine is 3 to 5 minutes. One cartridge contains 1.8 ml of LA solution. 2% lignocaine means 1 ml contains 20 milligrams of lignocaine. Pain of dry socket is usually experienced on the third day of extraction. A fractured mandible should be immobilized for an average of 6 weeks. Suturing in facial wound injuries should be done within 6 hours. Hypovolemic shock develops after the loss of 40% of blood. For primary closure of wounds, the patient should be reported within 24 hours after trauma. The factor important in irrigation of wound is the volume of irrigant. Minimum distance between implants should be, it is 3 mm. The gauge of needle used in dental syringe refers to the internal diameter of the lumen. During suture removal, the suture is cut at the point of entry into the tissues. The laceration of hard palate should be sutured at by giving releasing incisions. Minimum thickness of keratinized tissue around an implant is 1.5 mm. The most serious complication that could occur after surgery in maxillary canine area is cavernous sinus thrombosis. Treatment of irritational fibroma is simple excision. Treatment for cementoma is no treatment is necessary. Treatment of peripheral giant cell granuloma (PGCG) is excision of the entire lesion. Treatment of ameloblastoma is resection of mandible along with the tumor. Treatment for large cysts is marsupialization followed by enucleation. A patient with carcinoma of tongue has also an enlarged lymph node of the neck. What will be the treatment? The answer is commando operation. A patient has squamous cell carcinoma of the lip with invasion into the alveolus. The patient is edentulous. What is the appropriate treatment? It is radical neck dissection. The TMJ can be best exposed through which incision? It is preauricular incision. Nasal antrostomy is done in inferior meatus, which is the largest of all. Maxillary sinus opens into the middle meatus. Normal prothrombin time is 10 to 14 seconds. The prothrombin time should be dash to carry out any surgical procedures. It should be 1.5 times the normal prothrombin time, that is 14 to 21 seconds. The muscle which is penetrated during inferior nerve block is buccinator. When drawing pus from an abscess of the pterygomandibular space from an intraoral approach, the muscle most likely to be transected is again buccinator. Trismus after inferior nerve block is mostly due to needle injury to which muscle? It is medial pterygoid. The muscle which is mostly encountered in an incorrect infraorbital nerve block is quadratus labii superioris. The first direction of force to be applied by the forceps for an extraction of tooth is in the apical direction. Multiple odontogenic keratocysts are seen in which syndrome? It is Gorlin-Gold syndrome. Multiple odontogenic cysts are seen in Marfan syndrome. Most likely cause of tender swelling in the submandibular triangle is lymphadenopathy. The best oral sedative drugs used currently in dentistry are benzodiazepines. The treatment of choice for traumatic bone cyst is opening the cavity and induced bleeding. The optimum length of screw for fixation of plate in mandible is 4 mm. In Luhr system, that is LUHR system of plating, the two individual compression screws move through 1.6 mm. The amount of bone that should be destroyed to manifest radiologically is 30 to 60%. Hyperbaric oxygen uses 100% oxygen at 3 atmospheric pressure. In hemophilic patients before surgery, the factor 8 concentration should be raised at least by how much percentage? By 50 to 70%. 1 unit of fresh blood raises the hemoglobin concentration by 1 gram%. The crystalloid which should be used in hypovolemic shock is Ringer's lactate. A patient with maxillofacial trauma requires dash amount of daily sodium. It is 100 millimoles. A patient with maxillofacial trauma requires dash amount of daily potassium. It is 60 millimoles. CPR or cardiopulmonary resuscitation should have a ratio of chest compression to mouth breathing of 4:1, that is 72:16. The thickness of split thickness graft is 0.3 to 0.5 millimeters. The thickness of full thickness graft is 1 to 1.15 millimeters. Which blood group is universal donor? It is O negative. Biopsy specimens removed for examination are immediately placed in 10% formalin. The roots of which tooth after first maxillary molar lies close to the maxillary sinus? It is maxillary second premolar. The protein content of less than 4 mg per milliliter is characteristic of which condition? It is odontogenic keratocyst. For a patient on periodic renal dialysis, minor oral surgery should be undertaken on 1 day after the dialysis. In cryosurgery, cell death occurs when the temperature falls below -20 degrees Celsius. Most frequently indicated treatment for odontogenic cysts is enucleation. During the removal of a maxillary torus, the mid portion of the palatine process of the maxilla is accidentally removed. What can one see? An opening into the nasal cavity. Energy range required to fracture the mandible is in the range of 45 to 75 kg per meter. Bones usually fracture at the site of tensile strain. Detachment of suspensory ligament of Lockwood will cause lowering of papillary level of eyeball. The weakest part of orbit is the floor of orbit. One of the important features of Leaford 1 fracture is bleeding into the antrum. The minimum acceptable value for a hematocrit for elective oral surgery is 30. Most commonly, the graft material is obtained from the iliac crest. The primary airway hazard for an unconscious patient in a supine position is tongue obstruction. The optimum site for intravenous sedation in an outpatient is the median cephalic vein. The respiratory condition which is most alarming during patient sedation in a dental hospital is apnea. The most common anesthetic complication occurring within the first day after surgery under general anesthesia is atelectasis. The lab tests which should be considered before deciding whether to use general anesthesia or not are: first is complete blood picture and second is urine analysis. To anesthetize mental nerve, the site of nerve block is given between the first and second premolars inferior to their root apices. Most common cause of death occurring in patients under GA is due to respiratory obstruction. The primary site of local anesthetic action is the nerve membrane. The best monitor of the level of analgesia is verbal response. Gunshot fracture of the facial bones should not be treated via open reduction because the numerous small fragments will lose their vitality when the periosteum is reflected. Whitnall's tubercle is present where? Below the zygomaticofrontal suture. In most medical emergencies, the easiest technique for opening the victim's airway is to strike him on the back. If both the parents have cleft lip and palate, the probability of the first child having the same condition is 3:5 or 60%. In syncope, the pupils will be dilated. Simple extractions in hemophilic patients are carried out by the means of intraligamentary injection. The most important step for control of postoperative bleeding is application of local pressure. Visible bleeding of an artery is best controlled by electrocoagulation, clamping, and ligation. The most common complication after surgical removal of impacted mandibular tooth is loss of blood clot or dry socket. The main disadvantage of semilunar flap is limited accessibility. The most common site for dry socket is lower molar area. During extraction of maxillary teeth, the patient should be positioned in such a way that the occlusal plane of the mandibular arch is at how many degrees to the floor? It is 45 degrees to floor. How should be the occlusal plane in mandibular teeth extraction? The plane should be parallel to the ground. Few days after extraction, the patient develops discoloration over submandibular and suprasternal area. What is the probable diagnosis? It is postoperative ecchymosis. The tooth in the maxillary arch, which is difficult to anesthetize by infiltration technique, is maxillary first molar because of the thick zygomatic buttress in this region. The purpose of nitrogen gas-filled bubbles in anesthetic cartridge is to prevent deterioration of the vasoconstrictor. The group of drug abusers, which are known as walking time bombs, is cocaine abusers. Subjective symptoms are mostly absent in which blocks? Buccal nerve block and posterior superior alveolar nerve block. General anesthesia is contraindicated in two conditions: hemoglobinopathies and patients with acute respiratory infections. The immediate post-operative complication following aspiration of liquid vomitus into trachea and bronchi are bronchitis and chemical pneumonia. In extraoral technique for mandibular nerve block, the needle is directed in which direction to the lateral pterygoid plate? It is posterior direction. In extraoral technique for maxillary nerve block, the needle is directed in which direction to the lateral pterygoid plate? It is in the anterior direction. So posterior for mandibular and anterior for maxillary. Contraindications for nitrous oxide oxygen sedation are hemoglobinopathies, emphysema, emotional instability, and upper respiratory tract obstruction. Common side effects following nitrous oxide oxygen administration is nausea, diffusion hypoxia, and behavioral problems. The main route of elimination of nitrous oxide is through lungs. In patients on artificial ventilators, the cycle of exhaled air ventilation should be repeated for every 5 seconds. The first sign of moderate lignocaine toxicity is nervousness and drowsiness. Stenson's duct opens into opposite the maxillary second molar. To anesthetize the anterior palatine or greater palatine nerve, the nerve solution should be deposited where? Near the greater palatine foramen between the maxillary second and third molars. In an irradiated field, the optimal time for surgical procedure is 4 to 6 weeks. The teeth in mandibular arch which can be removed after inferior alveolar and lingual nerve blocks are all the teeth anterior to the second premolar. Natural local anesthetic agent is cocaine. Local anesthetic agent with intrinsic vasoconstriction property is cocaine. LA, which is most dilating of all, is procaine. LA, which has the least dilating property, or LA, which is used in patients in whom the vasoconstrictor is not required, is mepivacaine. Safest LA given in children is chlorprocaine because of its short duration and less toxicity. The most toxic of all LA agents is propoxycaine. LA, which causes methemoglobinemia, is prilocaine and articaine. Water-insoluble topical anesthesia are benzocaine and lidocaine base 5%. Water-soluble topical anesthesia are tetracaine, lidocaine hydrochloride 2 or 4%, and benzyl alcohol. LA with the longest duration of action are etidocaine 200 minutes, bupivacaine 175 minutes, and tetracaine 175 minutes. LA with the shortest duration of action is chlorprocaine. LA, which is widely used in dentistry, is lidocaine. EMLA is eutectic mixture of local anesthesia which comprises of 2.5% lidocaine and 2.5% prilocaine. LA, which causes cutaneous vasoconstriction, is ropivacaine. LA with high pKa value is procaine. LA, which undergoes biotransformation in kidney, is prilocaine. Coming to some clotting factors in play. Factors that participate in extrinsic pathway, that is factors which are measured by prothrombin time, are factor 3, 4, 5, 7 and 10. Then factors that participate in intrinsic pathway, that is those factors measured by partial thromboplastin time, are factors 4, 5, 8, 9, 10, 11 and 12. And factors that participate in common pathway are 4, 5 and 10. Factors that are absent in stored blood are 5 and 8. Vitamin K dependent factors are factors 2, 7, 9 and 10. Factors synthesized from liver are 2, 7, 9, 10 plus factor 1 by 5. And cryoprecipitate is a rich source of which factor? It is factor 8. Hemophilia A is caused by the deficiency of factor 8. Hemophilia B is caused by deficiency of factor 9. Hemophilia C is caused by deficiency of factor 11. Parahemophilia is by deficiency of factor 5. And von Willebrand disease is by deficiency of von Willebrand factor. Now some common instruments. The periosteal elevator most commonly used in oral surgery is number 9 Molt periosteal elevator. The hemostat most commonly used in oral surgery is curved hemostat or Kelly hemostat. The instrument commonly used for removing bone is Ronger's forceps. The needle commonly used in closing mucosal incision is small 1/2 circle or 3/8 circle suture needle with a reverse cutting edge. The size of suture commonly used in suturing oral mucosa is 3O. The most commonly used suture for oral cavity is 3O black silk. The most commonly used suture scissors are Dean scissors. Most commonly used instrument to retract the tongue is mouth mirror. The two commonly used cheek retractors are right angled Austin retractor and Austin retractor. The most commonly used elevator to luxate teeth are straight or gauge type. The second most commonly used elevator is triangular or pennant shaped. Blade commonly used for skin incision is number 10 blade. Commonly used blades for intraoral surgery are number 11, 12 and 15. The blades commonly used in gingivectomy is number 11 and 12. The blade primarily used for making small stab incisions such as incising an abscess is number 11. The hook blade commonly used for mucogingival procedures is number 12. The blade used for incising periodontal abscess is also number 12. The most commonly used scalpel blade for intraoral surgery is number 15. Now I'll state some of the signs and symptoms of important fractures of the middle third face. For zygomatic complex fractures, the signs and symptoms include flattening of cheek, retrobulbar hemorrhage, that is hemorrhage within the muscle cone, anesthesia of cheek due to involvement of zygomaticofacial nerve, and temple due to involvement of zygomaticotemporal nerve, interference with opening and closing movements due to impingement on coronoid process of mandible, and hooding of the globe of eye. For zygomatic and Lefort 3 fractures, the sign is hooding of globe of eye. So the level of globe of eye is normally maintained by suspensory ligament of Lockwood that extends from lacrimal bone to Whitnall's tubercle situated on the inner aspect of zygomatic bone just below the zygomatic suture. In Lefort 3 and zygomatic fractures, there is separation at this suture line resulting in drop of level of globe of eye. Next, the sign for Lefort 1 or Guerin fracture is floating maxilla. The term floating maxilla is due to movement of maxillary complex as a single unit at the frontonasal area. For Lefort 3 fracture, the important sign is moon face or dish face deformity or ballooning of face, which is due to edema following the fracture of maxillary complex. In nasal fracture, the important sign is epistaxis. In zygomaticomaxillary and Lefort 2 fractures, there will be paresthesia, mostly due to involvement of infraorbital or zygomatic nerves. In subcondylar fracture, there will be bleeding from ear. In blowout fracture of orbit, there is hanging drop sign in maxillary sinus radiograph, and hanging drop sign is best seen in Waters projection. In severe nasoethmoidal and Lefort 3 fractures, there will be traumatic telecanthus, that is detachment of medial canthal attachment of eye. In Lefort 2, 3 and severe nasoethmoidal fractures, there will be CSF rhinorrhea, which is seen as tramline effect. It is due to fracture of cribriform plate of ethmoid. In LeFor 2, 3 and nasal complex fractures, there will be epiphora, that is watering of eyes due to involvement of nasolacrimal duct. In bilateral condylar fracture and horizontal fracture of maxilla, you will observe an open bite. In zygomatic complex fracture, there will be enophthalmos. In orbital fracture and LeFor 3 fracture, there will be increase in orbital volume due to herniation of orbital contents through ethmoid bone on the medial wall of orbit. In all cases of LeFor 3 and some cases of LeFor 2, there will be panda facies. Panda facies is due to edema and ecchymosis around the eyes. Because of this, the patient develops black circles around the eyes, which is also called as raccoon eyes. The fracture of edentulous mandible is called as bucket handle fracture. Bilateral fractures of body of edentulous mandible near the posterior attachment of mylohyoid at the molar area is called as bucket handle fracture. Fracture occurring in epileptics and elderly patients and soldiers is guardsman fracture. This is a type of multiple fracture commonly seen in epileptics, elderly patients who lose consciousness as a result of general disease, and occasionally in soldiers who faint on parade. In the fracture of coronoid process, you will observe telltale hematoma. For the fractures of base of skull and condylar fractures, there will be Battle's sign. This is the hematoma surrounding a fractured condyle may track downwards and backwards below the external auditory canal. This gives rise to ecchymosis of skin just below the mastoid process on the same side, which is called as Battle's sign. LeFor 1 fracture will show Guerin's sign, which is ecchymosis at the greater palatine foramen. In mandibular fracture, there will be Corman's sign, which is ecchymosis in the lingual sulcus, pathognomic of mandibular fractures. Now let's look at some instruments and their uses. So Ash forceps, ASH, Ash forceps, it is used in extraction of lower incisor. Next is Walsham or Ash's forceps. Here the Ash is ASCHE. So Walsham or Ash forceps, it is used to reduce nasal complex fractures. Then Rose disimpaction forceps, it is used to reduce the tooth-bearing portion of the upper jaw. Next comes the Bristow's elevator. It is used to elevate the fractured zygomatic bone. Next comes the number 16 Cowhorn forceps. It is used to extract mandibular molars. Next is the osteotome. An osteotome is used to split tooth and removal of the bone. Then comes a chisel. Again, chisel is used to split the tooth and to remove bone. Lastly, ronger. A ronger is used for trimming of bone. Coming to some of the aspirates from some cysts and tumors and what their pathology suggests. Okay, so if you aspirate a cyst and you find pus or brownish fluid with paste-like or caseous consistency, then it means it is an infected cyst. If you find mucus, it could be mucocele or a ranula. If there is air on aspiration or golden yellow fluid, it can suggest traumatic bone cavity or solitary bone cyst. If there is blood on aspiration, it suggests vascular malformation in the jaw, aneurysmal bone cyst, or central giant cell granulomas. If there is clear, pale, straw-colored fluid with total protein in excess of 4 grams per 100 ml, then it is a tentigerous cyst. If there is dirty, creamy white viscoid suspension of keratin with protein level of less than 4 grams per 100 ml, then it is an odontogenic keratocyst. Now let's see some important compositions. Some solutions and their compositions. First is Tabot's solution, TABOTS, Tabot's solution, which is used as an astringent in pericoronitis. It contains iodine, zinc iodine, glycerine and water. Next is bone wax. Bone wax is used to reduce bleeding. It contains 7 parts of yellow wax, 2 parts of olive oil and 1 part of phenol. Next is Carnoy solution, CARNOY, Carnoy solution. It is used for fixing the tissue in the tumor bed. It contains absolute alcohol 6 ml, chloroform 3 ml and glacial acetic acid 1 ml. Next is the Mekin's solution. It is used for bleaching of vital teeth. It contains 1 part anesthetic ether 0.2 ml, 5 parts of HCl 36%, that is again 1 ml, 5 parts of hydrogen peroxide 30%, which is again 1 ml. And last is whitehead varnish. It contains iodoform 10 grams, benzoin 10 grams, prepared storax 7.5 ml, balsam of tolu 5 grams and solvent ether 100 ml. It contains number of aromatic resins which slowly broken down to produce benzoic acid, which is a potent antiseptic. Coming to the last list, let's look at some conditions and the nerve that may be involved in that condition. First is Denker's operation. The nerve that may be injured in this operation is anterior superior alveolar nerve. Next is surgical removal of mylohyoid ridge. In this surgery, you can injure lingual nerve. Next comes the submandibular or residence incision. In this condition, the nerve that can be injured is marginal mandibular branch of facial nerve. Next, the preauricular incision. If the incision extends downwards beyond the attachment of pinna, then there is chances of injury to facial nerve. Also, the upper margin of the incision is curved anteriorly in order to save the auriculotemporal nerve. Next, during the surgical removal of parotid gland, there is chances of injury to the facial nerve. Next, the transoral silolithotomy of submandibular duct can lead to injury to the lingual nerve. So this brings us to the end of the Rapid One-Liners episode in oral and maxillofacial surgery. I'll see you in the next episode tomorrow. Till then, happy learning, NEETABLEs.